Hello everyone, my name is Curie from Seoul, Korea, and thank you for this opportunity to discuss with you about organ incentive system in promoting organ donation. In 2015, Frank Delmonico and others have been published about living and disease organ donation related to financially neutral act, which can be summarized that organ donation should remain as an act that is financially neutral for donors, neither imposing financial burdens nor enriching them for monetarily. So we can divide in 4 sectors to discuss about financial problem related to organ donation, living and disease, and financial gain and financial burden. And let's start with financial gain related to living donors. In principle, WHO mentioned that cells, tissue, and organs should only be donated freely without any monetary payment or other reward of monetary value. And it's pretty much the same to the Declaration of Istanbul. In summary, WHO principle suggested that national law should ensure that any gift or rewards are not in fact disguised form of payment, and the incentives in the form of reward with monetary value that can be transferred to third parties are not different from monetary payment. Of course, there are some forms of disguised form of reward, including contribution to donor retirement fund, or income tax credit, or scholarship or tuition voucher, or means to start business. However, in many cases, it's very difficult to figure out which is really an incentive or not. So, making the national law to stop this is quite easy, but really find the disguised form of reward with monetary value is more difficult in a practical life. So, the financial gain related to living donor donation is we really need to focus our effort to incentives in the form of reward with monetary value, but this is quite difficult. About living donor financial burden, and there have been published that WHO's guideline principle 5. It says the prohibition on sale or purchase of cells, tissue, and organs does not preclude reimbursing reasonable and verifiable expenses incurred by donor, including loss of income or paying the cost of recovering, processing, preserving, and supplying human cells, tissues, or organs for transplantation. And this is also same in Declaration of Istanbul. But the question is, what is not included? Who will pay and how to pay? As you know, lots of fees are needed for organ acquisition and non-organ acquisition for living organ donation. In 2016, Hayes et al. Divided the cost into 5 different groups of pre-donation, peri-donation, post-donation, direct non-medical expenses, and non-direct expenses, which have a receipt to get reimbursed. Who will pay issues in DOI says such cost reimbursement would usually be made by the party responsible for the costs of treating the transplantation recipients. So, DOI approved the cost of any medical and psychological evaluation of potential living donors, also costs incurred in arranging and effecting the peri and post-operative phase of the donation process, and medical expenses incurred for post-discharge care of the donor, and lost income in relation to donation. However, in Korea, we pay only 1 and 3, so 2 and 4 should be the out-of-pocket money. Moreover, for women, household chores are not covered because we cannot submit any receipt to the institute. So, in Korea, lost wages and travel expenses are not included, and the long-term health maintenance is not included, and incidentals are not included, and also potential future insurability is hampered by organ donation is not included, and all of this could be the financial burden for the living donor. Not only Korea but also Canada had to pay more than 4,000 to 5,000 out-of-pocket money for organ donation because this part they don't have any reimbursement system. So, if the country has universal coverage, there is no issue, but there are partial coverage. We should improve the coverage system. If there is no coverage, usually recipient pays direct or indirect way, or we have to find new funding sources. Like USA, those who do not have Medicare eligibility cannot be reimbursed when they do the organ donation, and in Philippines pay only hospital fees. So if the donor or the recipient is not prepared for the extra expenditure, the donation process cannot go through. So for payment, if the process exists, then it's fine, but we have to clarify current policy, and the policy needs to be changed and added, and the new funding resources should be sought. Like here, issues by the federal government of a national guidance document and the contracting guidelines for private insurance covers, and policy initiative to offer living donor civil protection and resource allocation to develop systems for wage reimbursement and the coverage of living donor medical needs long term. So, like in Canada, every country should develop the best practice building program for living donation related care for cost recovery and minimize donor burden, and also keep regulatory compliance. And then how to pay. WHO did not mention about it, but all of us agree that to DOI that it should be made directly to the party supplying the service, not directly to the donor or donor family. So the living donor financial burden issues is related to what is not included and who will pay. And then let's move to the burden for deceased donor. This is quite similar to the living one. In 2016, Professor Capron and their team has published Statement of Declaration of Istanbul Custodian Group regarding payment to families of deceased organ donors. Reimbursement of donation-related expenses in deceased organ donation is not a big problem if they can pay, like in living organ donation. But who will pay will be the same issue like living. So, like countries with successful disease donation program like Spain or Croatia, government will pay the cost. However, many Asian countries, including Philippines, the payment is the fee is paid by the recipients. Korea, about 10 years ago, recipients have paid, and then the recipient hospital paid, and now the national health insurance covered the donation fee. But the burden issues of deceased organ donation is quite similar to the living donor donation. But the financial gain related to deceased donor is quite complicated. Korean Transplantation Act has been established in 1999, which bans organ trafficking, and we revised our law in 2010, which included establishment of independent IOPO and also reporting system for possible candidate donors, deceased donors. And our Transplantation Act and our society advocates for voluntarism and altruism, and we do against commercialism in organ transplantation, and also we support the international ethical principles. However, according to our Transplantation Act 32, financial support for deceased donor families are possible by government under the name of condolence payment, and also by the government for funeral fee, and also from the recipient hospital a funeral fee. In the statement of DICG regarding this organ donation, the background has been described that they found pay sums of their behalf for funeral costs or for hospital expenses, and they argue that the officials will argue that without such financial incentives, sufficient organ would not be donated, or the payment as an appropriate reciprocity for the family gift to the community, which is really outside the circle of ethical transplantation practice, which was guided by DICG. Ethical principles also say providing money to people to encourage them to consent to organ removal or reward them for doing so weakens organ donation program. In summary, first, countries with successful deceased donation program do not offer any material incentives to the donor family. That's fair, but some countries continue to offer argument in favor of offering something to the donor family, because without such financial incentives, sufficient organ would not be donated. So they have 16 articles related to the application of principle to deceased donation. The first part is the payment to next of kin fall into the category of organ commercialism. B is adverse effect on society and legitimate transplantation program. C, adverse impact on donor families. D, ethical objections to payment. And their conclusion was, for all of these reasons, countries should not establish or allow or operate public or private programs that pay money to or for the benefit of next of kin, whatever. But as all of us know, the organ donation from deceased donor is a very complex and emotional procedure related heavily to their culture. So we discussed about why does the Korean government choose to give monetary reward to deceased donor family members. Many of us have thought it was an incentive 10 years ago to promote deceased organ donation, but there are another group of people are saying it is based on dichotomy of Korean recognition from peculiarity of Korean culture, especially affected Confucianism. Regarding the first question of financial incentives to promote deceased organ donation, it was not correct, because when we started our law about Organ Transplantation Act, we started monetary support. However, actual number of deceased donor was decreased. Actually, the whole system improvement caused increased the number of organ donors. So financial incentives to promote deceased organ donation was not correct, as we have published in 2015. We published that mandatory report of potential brain death was more important than financial incentives. supporting the giving next of kin money does not produce the highest donation rate. Second one is monetary condolence support for brain death donor family, a form of mutual help based on Korean culture. This topic was heavily debated among experts in the field of transplantation ethics, laws, and economics. And the main issue of this debate is distinction between direct or indirect, or incentive or mutual help. We had a conference and meeting for 6 months about what is commercialism, and we had 4 different serious questions. The first one, we thought dichotomy of Korean recognition of monetary support. If a person gives money to someone, then we think it's a bribe or incentive, but if it comes from government or a public organization, we think it's an aid or reward. There is a system that Koreans get funeral aid if they need. And second, we have a monetary gift system. In a Lunar New Year, we bow to our parents or grandma. Of course, we bow them freely, but we also think about getting a lot of money to fill our New Year pocket. And we don't think it's a trade, we think it's a gift. This monetary gift has been one of the most common form of gifts in Korea, and now it seems to spread to the world. So we think social aid or reward for heroic act by the government is beyond the compensation for organ donation, and indirect financial support from government is acceptable, and the monetary gift has been one of the most common forms of the gift. So we don't feel it's commercial. We feel it's non-commercial. The second issue is mutual help activities in Korea, which called Pumashi and Dure. So people share difficulties together and also share the financial burden. When we have a funeral, we have to rent a funeral house, and Korean funerals are often lavish 3-day affair with hundreds of guests are coming. Sometimes someone who does not know each other are coming and bow to the deceased person. And after bowing, we have a very, very nice dinner or lunch at the dining room, which costs a lot of money, like $6,200 US per each ceremony. So when you look at the book, for Korean culture, usually the guest should go to the desk first to sign up and also pay the condolence contribution in a box or in a slot. And it's quite common to see the Korean families count the money in the box, which can surprise our international friends. But we think it's a mutual help for funding. We think it's a mutual help, but not a trade. So lots of books regarding Korean culture, like the Word of Bereavement, mention about condolence contribution of Korea. And now in internet you can see the Korean funerals. You need to bring a little bit of money to support them. And this kind of culture needs to be accepted as one of the cultural diversity. And that is another opinion in our society. So adding condolence money is a form of mutual help, and cultural diversity should be respected. Even though it can be commercial in some way, lots of Korean people felt funeral condolence money is not a commercial one. So financial gain for deceased donor casted lots of questions in our society, including incentivity or reward, or monetary gift is proper, or mutual help, or incentives. Anyway, after 6 months of discussion about this issue, Korean Society of Transplant made this kind of statement. First, we recommend to stop providing consolatory fee from corners because it can cause misunderstanding in communication. Second, indirect support of funeral expenses as a meaning of condolence by the government, which is part of our own traditional culture, is acceptable. Hospital fees for disease donor management should be reimbursed via CONUS or CODA. The government and the Korean Society of Transplant should develop non-financial family support program. So, we rejected condolence money from the government because the language is very vague. Actually, this is similar to funeral fee, but we allow a government funeral fee, but we also declined recipient hospital pay for the funeral fee, and also we emphasized that information about consolatory funeral fee should be delivered after final decision of the family for organ donation to prevent coercion or influence. To reduce the influence of trade for possible financial support, and to make several articles satisfied by mentioning the financial support afterwards they made the final decision. After that, actually we face another issues regarding financial support for disease organ donation, that is related to adverse impact on donor families. Rarely we face some families fall into argument of getting money for funeral support, so who is getting, who is not getting thing. And sometimes families are arguing that they don't want to be paid for funeral because they donated it freely without any payment. Instead of that, they asked us to send them respect and gratitude in a real way. So we had to develop non-monetary way of express our gratitude, like ceremonies and memorial week or memorial parks. So this is our conclusion. And financial monetary gain for both living and deceased donor in this complex situation is very difficult to understand and very, very dangerous to provoke organ trafficking and unethical decision. The financial burden issue is also important for increasing possible organ donation because there are many areas that cannot be covered during the organ donation process. So, for financial gain for organ donation, current monetary system should go to indirect one, and through community education, it's desirable to become non-monetary, especially for deceased donors. And for financial burden for organ donation, it needs to clarify the current policy, and sometimes we need to change policy and find a new funding source to reduce the burden of donor and donor family. To do so, continuous research for development of ethically and culturally acceptable rewarding system for organ donors and their families is needed, and effort to establish ethical and efficient national transplantation program for supporting organ donors or their families should be continued. Thank you very much for your attention.